Hey, this is Paul from Jones Physical Therapy. If you're scheduled for a joint replacement or you're thinking about having one, you'll want to watch this. Modern joint replacements were first done in the 1960s. Since that time, they've become the most frequently performed orthopedic surgeries in the world. In the US alone, more than 1 million joint replacements are performed each year. Joint replacements routinely free people from the misery and limitation of joint disease and restore them to active, pain-free lives where they don't have to take medication every day to control their joint pain. People who have suffered joint pain for many years are usually very happy to have the diseased joint replaced with an artificial one. The thing I hear the most often from these folks is, "I wish I'd done this sooner." If you're considering a joint replacement, there are two people you need to know. Number one, orthopedic surgeon, obviously. Number two, physical therapist. The first you'll see for about 2 hours, and the second you'll see for about 3 months. Good rehab is critical to your success. First, you have to recover from your surgery, and next you have to reverse the accrued effects of having a diseased joint. You have to restore your balance, flexibility, and strength. And get the skills, you need the skills and guidance of a good physical therapist. And with a good physical therapist, these efforts will pay off for years to come. Joint replacements are supposed to last 15 to 20 years, but they often last much longer. Some of the first hip replacements done in the 1960s lasted for over 30 years, and technology has advanced in leaps and bounds since then. So the time you spend in rehab is a great investment for your success over the coming years, and even decades. Many of the people we know who've had a joint replacement go through two main stages in their recovery. Stage one, they begin to enjoy doing normal everyday activities like walking around the neighborhood or preparing a meal without having constant pain, taking medication, or having to get warmed up beforehand. It's true when they say you don't know what you have till it's gone. So these folks really appreciate having their function back. Stage two, they start thinking big. As soon as they get stronger and more confident, they start thinking about the big things that they've been missing out on. Things like vacations, cruises, hiking, riding bikes, and other activities that they may have either consciously or subconsciously given up on. All of a sudden, those limitations are gone, and a whole new chapter can start. So having a joint replacement can not only return you to the routine things that you enjoy and appreciate about life, but also they can open up the possibility of doing things that you never thought you would be able to do, or things that you always dreamed of doing. If you've already scheduled a joint replacement, or if you're still thinking about it and you want to know more about the rehab and the physical therapy involved, I invite you to come visit us, sit down with one of our PTs. We'd love to talk about the rehab you're going to do, what you can expect from your PT, and what we can expect from you for a successful outcome. We'll answer all the questions you have for us. We can also give you some exercises and stretches to do at home in preparation for your surgery. The stronger you are going in, the better outcome you'll have coming out. So let's make this the year you look back and say, "I wish I'd done that sooner."